EMT Exam Prep Emergency Medical Technician Practice Test, 35 difficult questions. Question 1. What is the first step in the primary assessment of an unconscious trauma patient? Check for a pulse. Open the airway while maintaining C-spine stabilization. Expose the chest. Obtain a blood pressure. Airway is the priority, with C-spine protection in trauma. Question 2. A patient has a respiratory rate of 6 breaths per minute. The EMT should apply a non-rebreather mask at 15 L/min. Begin positive pressure ventilation with a BVM. Apply a nasal cannula at 4 L/min. Observe the patient for 5 minutes. 6 breaths/min is inadequate. The patient needs assisted ventilation. Question 3. Which of the following is a sign of decompensated shock? Tachycardia, falling blood pressure, anxiety, pale, cool skin. Hypotension is a late sign indicating the body can no longer compensate. Question 4. When assessing a patient with a possible stroke, the EMT uses the Cincinnati Pre-Hospital Stroke Scale. What are the 3 components? GCS, BP, heart rate, facial droop, arm drift, abnormal speech, pupils, strength, sensation, nausea, headache, dizziness. These 3 signs are highly predictive of an acute stroke. Question 5. A 60-year-old male complains of chest pain. His BP is 80/50ths. Can the EMT assist with his nitroglycerin? Yes, it will help the pain. No, nitroglycerin is contraindicated in hypotension. Yes, but only half a dose. No, nitroglycerin is only for patients under 50. Nitro is a vasodilator and will further lower the BP, which is dangerous in a hypotensive patient. Question 6. What is the compression to ventilation ratio for 2 rescuer adult CPR? 15:2, 30:2, 5:1, 10:1. The ratio for adults is 30:2 regardless of 1 or 2 rescuers. Question 7. An occlusive dressing is used for which type of injury? A simple skin tear, an open chest wound, sucking chest wound, a broken leg, a burn. Occlusive dressings prevent air from entering the pleural space through a wound. Question 8. Standard precautions in EMS include washing hands only when they look dirty, using PPE, gloves, goggles, etc., for every patient contact where exposure is possible, treating only sick patients with care, wearing a gown for every call. Treat all body fluids as potentially infectious. Question 9. Which of the following is the golden period in trauma? The first 10 minutes on scene. The first hour from the time of injury to definitive care. The time it takes to get to the ambulance. The first 24 hours of recovery. The golden hour emphasizes rapid transport for surgical intervention. Question 10. A patient with an airway obstruction who is still conscious and coughing should be given back blows, given abdominal thrusts, encouraged to cough and monitored closely, intubated immediately. If they are coughing, the obstruction is partial. Do not interfere unless it becomes total. Question 11. Where do you check a pulse on an unconscious infant? Radial, carotid, brachial, femoral. The brachial pulse is the standard for infant assessments. Question 12. What is the dose for an adult EpiPen? 0.15 mg, 0.3 mg, 0.5 mg, 1 mg. Adult dose is 0.3 mg, pediatric is 0.15 mg. Question 13. Glasgow Coma Scale (GCS) measures eye opening, verbal response, motor response, heart rate, BP, SpO2, pain, temperature, reflexes, age, weight, height. GCS provides a score from 3 to 15 to assess neurologic status. Question 14. A patient has deep, rapid respirations often seen in DKA. These are called Cheyne-Stokes, Kussmaul respirations, agonal gasps, wheezing. Kussmaul breathing is the body's attempt to blow off CO2 to compensate for metabolic acidosis. Question 15. Which heart rhythm is the AED designed to shock? Azystole. Ventricular fibrillation, VFib. Normal sinus rhythm, P. Pulseless electrical activity. AEDs shock VFib and pulseless VTach. Question 16. CPAP is most useful for which patient? An unconscious patient, a patient with pulmonary edema and respiratory distress, a patient with a pneumothorax, a patient with facial trauma. CPAP helps keep alveoli open and pushes fluid back into the vasculature in CHF/pulmonary edema. Question 17. The rule of nines is used to estimate blood loss, the percentage of body surface area, BSA, burned, the depth of a burn, the patient's age. It divides the body into sections of 9%, or multiples thereof, to estimate burn size. Question 18. Which of the following is a symptom of a myocardial infarction? Chest pressure radiating to the left arm, diaphoresis, sweating, nausea, all of the above. Me can present with various symptoms, including silent ones in diabetics/elderly. Question 19. When suctioning an adult patient, you should suction for no longer than 5 seconds, 15 seconds, 30 seconds, 60 seconds. Suctioning removes oxygen as well as secretions. 15 seconds is the limit. Question 20. Triage in a mass casualty incident, MCI, means treating the easiest patients first, sorting patients based on the severity of their injuries, waiting for the police to arrive, taking everyone to the same hospital. Triage ensures the most critical, salvageable patients get care first.